In this video, we are going to go over a strategy that you can utilize for your little babes 0 to 3 months, maybe 4 months, in order for them to engage the lower abdominal muscles, work on rounding that back, especially if you have a babe that is arching. This is gonna be a strategy that you are going to want to have in your toolbox. Stay tuned. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we help proactive parents learn tips and tricks to help their babies move better. Think of me as your pediatric physical therapy bestie, here to help you learn how to help your babies move with confidence and ease. In today's video, we are talking about one of my favorite little exercises that you can do for your little babes. In this video, we have a 8-week-old, but this is something you can do from newborn on, and it is gonna help babies learn how to flex their spine and tilt their pelvis up. That is gonna support and kind of help them learn how to tolerate that belly position and also prep them up for increasing their strength and their lower abdominals, as well as encourage and prep them for that mini milestone of grabbing their feet. Some babies, especially babes who are struggling with reflux or babes that had some twisting in their in utero position, they could prefer that extension posture and really struggle with rounding out their back and tilting their bum. And that can be a disadvantageous position for babies to fall into the habit of being in. So I have a baby who resists tilting their pelvis up. This is an activity that I'm going to give mom and dad so that they can start breaking that extension habit, as well as it's super easy for parents because it requires no real work. In this video, I'm going to show propping the bottom up on my foot or on my leg. You can also supervised utilize a folded up bath towel or a pillow. You don't want to prop a baby up on something like a boppy or a throw pillow or a beach towel / bath towel and then leave them like that unsupervised. So make sure that it's always supervised if you use an external device, but this can help babies kind of relax into this position. It can help their bellies relax, and you can also do different activities while in this position. You can help them grab toys, bat at toys. You can also do a little bit of abdominal massage. So there's a lot of different things you could add to this position, but essentially you're gonna wanna be in this position or help them stay in this position for 1 to 5 minutes while they are just kind of relaxing into it.
Oh, shh. Good work, Anna. Good work, sweet girl. Good work. Good job. Good job. Yeah. Yeah. What we do this? Can we play? We can tuck. Oh, what's here?
I can take it off.
Oh, good. You tap it off. Good work. I know, sweet girl. What do you find? Go over here. Good job. Tap.
I think I'll tilt down.
Did you see a banana? Did you see a banana? Did you see a banana? Yeah. Good job. Oh, are you dressing your baby?
Yeah.
And that's a wrap, friends. Thank you so much for taking time out of your busy schedule to learn tips and tricks on how your baby is moving with me. I really am so passionate about trying to create a movement in which parents feel empowered to do these strategic play activities and these strategic movement activities with their babes so that they connect with them more, those babes can move better, and we're able to really just have more connection with our kiddos from such a young age. If you have any additional questions, make sure that you check the pinned comment, because there you're gonna find a link on ways that you can work more directly with me via online parent consultation and other means so that we can have a way to answer all of your questions. If you are still curious about ways that you can help a super little babe move well, make sure that you check this video out next, because it is that next step in this movement progression that is going to help a baby start getting ready for that next milestone, which is rolling and also obviously tolerating tummy time for more than 3 minutes.